cervical spine is comprised of 8 cervical nerves, 7 vertebrae, and the occiput. All need to work together smoothly to provide a healthy, pain-free life. The Cervico 2000 was developed to bring a unique ambulatory dynamic traction method to the sufferers of cervical spine injuries and disorders. Place the jack mechanism at the lowest possible position. This is called the zero position. Make sure that the upper and lower straps on one side are attached securely to the Velcro fastening strips. Place the collar on the collarbones and shoulders so that the front of the jaw rests gently on the chin support. While the device is still in zero position, place the brace so that it is centered directly over the cervical vertebrae directly under the occiput. Make sure that the brace pad is placed tightly on the occiput and not simply resting on the shoulders, as this will counteract any traction by the device by allowing the head to recline. Pull the upper and lower straps to tighten them and then fasten them to the Velcro fasteners on the front of the device. The straps should rest in the guide channels on the outside of the upper and lower jack mechanisms. The collar and chin supports should fit snugly without pain or discomfort. During self-treatment, it is recommended that the patient fit the device in front of a mirror. With the device resting comfortably, it may be necessary to adjust the placement of the collar. It is possible to move the traction rods forward or backward in the traction rod housing for a secure, comfortable fit. Only after the device is properly positioned is it possible to apply traction as necessary. When the patient is ready, begin applying traction by gently lifting both traction levers simultaneously. In cases of self-treatment, it is recommended to use the index and middle fingers to grasp the top of the traction housing and then to apply firm pressure with the thumb to lift the traction levers. Repeat the action until the skin of the neck is taut and there is resistance to the traction of the device. It is possible to apply asymmetrical traction when needed, such as in cases of torticollis or radiculopathy to the left or to the right, by jacking one side more than the other. Again, traction should be applied slowly to avoid discomfort. Upon finishing the treatment session, release the traction by pressing down on the release handles. Release traction slowly and simultaneously on both sides. Once the device has been returned to the zero position, release the upper and lower straps and remove it while the patient is sitting.